Hello, this is Pharmacist Donald. If you are seeing us for the first time, you are highly welcome. If you are a returning viewer, this is me telling you thank you. We are always here to give you the best. No knowledge is wasted. So, in the last video I posted about artesonates, I saw a couple of questions in my DM about how long artesunate can be taken. First and foremost, I want to answer that question here in this video and more other things to discuss about today. So, artesunate firstly is used to treat severe malaria. You know, so once one is down with it, severe malaria, shaking, vomiting, and all of that. Firstly, the first dose of artesunate is given at 0 hour, that is on admission. You give the first dose. If you did not watch the previous video on how it is reconstituted, it is calculated, and the dosing, you never to go back to see the video. Then giving the first dose on admission 0 hour, after 12 hours, the dose is repeated. Then 24 hours from admission, another dose is given. That is 3 doses within 24 hours. So if this patient is able to tolerate oral ACT, you can stop the injection and continue with oral ACT on day 2. But if the patient is not able to tolerate oral ACT, then you continue artesunate daily one daily until the patient is able to tolerate oral ACT. But after 24 hours, if the patient is not able to tolerate oral ACT after 24 hours, within 72 hours, that is 2 daily dose is given. The patient should be able to tolerate oral ACT by then. Then the injection should be switched to oral ACT. So that is how artesunate is given, and it is very, very effective in treating malaria. And always endeavor to continue with the oral ACT if you are taking injection, because those injections, they are monotherapy. So after treating with the monotherapy for 3 days, or in the case of artesunate for 24 hours, 3 doses, endeavor to continue with oral ACT, either artemether lumefantrine or any other combination, as the case may be. And the pharmacist will instruct you on how to take your medication. Then that's by the way. In this practice, we experience a lot of things. The other day, a lady walked into my place and requested for antibiotics. I asked her what antibiotics she wanted. She said she wants Ampiclox. Yes, 1 capsule of Ampiclox. That drew my attention because it is unusual. You can't take just a capsule of Ampiclox. That is antibiotics abuse. I asked her, what do you intend to use these antibiotics for? She said she had unprotected sex with her boyfriend, that she want to take the Ampiclox so she can prevent pregnancy. What? Auntie, no now. I want to ask you a question. Is sperm cells bacteria? No. Sperm cells is not bacteria. So in as much as sperm cell is not bacteria, antibiotics cannot kill sperm. So if you think taking antibiotics can prevent you from getting pregnant, you are wrong. So if you like, take antibiotics, a whole truck full of antibiotics after unprotected sex, you'll still be pregnant because sperm cells is not bacteria. And moreover, by so doing that, you are abusing antibiotics. Understand? So after unprotected sex, what you should do is to go for oral contraceptives. Understand? To prevent pregnancy. If you're not ready for pregnancy, go for oral contraceptives. And mind you, oral contraceptive is not to be taken more than once in a month. But I know that some people, like the other day, a lady said she takes it twice a week. The other day, the other one said she takes it anytime she has sex, unprotected sex. Auntie, you are doing yourself more harm than good, because these drugs have side effects. So if you must take it once a month is okay. Understand? And to even avoid that, there are protection, there are condoms, different brands of condoms in the market. Get anyone. If you're not ready for pregnancy, instead of abusing antibiotics, tomorrow, if you have a need for antibiotics, you see that going for antibiotics sensitivity test in your isolated organism, you see that you'll be resistant to almost all the class of antibiotics because you have been abusing antibiotics over time. Okay, so after unprotected sex, what you should do is to go for oral contraceptives rather, to prevent